So I think as we go, so people will keep joining in. Yeah. Mhm. All right. So good afternoon, everyone. So welcome to our second webinar in our series featuring the world-renowned public health physician and educator, Professor Manoj Sharma. I'm Dr. Nagu Penkachayala, President and CEO of the British Association of Primary Care and Allied Professionals. And it is my privilege to introduce today's esteemed Maverick speaker and our distinguished team. Before we proceed, I would like to acknowledge Dr. Sam Bethapudi, our chair, who has been an invaluable leader in shaping BAPCAR mission. I would also like to recognize two of our
Introducing
dedicated.
me. The topic of my presentation, as Dr. Nagu mentioned, is practical stress management, promoting and improving mental health. So in the initial part, I will elaborate a little bit on my background, and then I'll delve right into what mental health is and what are some practical tips for stress management and so on and so forth. So I started my career as a physician with a residency in internal medicine from University of Delhi in India. And then I moved into public health, working for a not for profit organization, Voluntary Health Association of India, which is a federation of 4,000 organizations. And I did participatory training for senior level, mid level, and grassroots level functionaries using the model of Freire and Praxi in particular. And then I immigrated to the United States in 1992, did my master's and doctorate in preventive medicine from the Ohio State University School of Public Health, College of Medicine. And then while working on my doctorate, I worked part-time jobs at several universities, Central Michigan University, Walden University, Southern Illinois University at Carbondale National University. I was a visiting professor at Chongqing Medical University in China. And I was a professor at University of Cincinnati for 10 years. I still work for Ohio Commission on Minority Health. And I was a professor at Jackson State University, which is a historically Black university, for 6 years. I taught MPH and TRPH students and helped establish the first accredited school of public health there. Right now, I am professor and founding chair of the Social and Behavioral Health Department at the University of Nevada, Las Vegas. My research areas are in health behavior research, within health behavior research.
Observing, I'm sure in the Western world, I don't know how much in India, and Dr. Nagu has an interest in it as well. One is the neurodevelopmental disorders and also neurodiversity, adult ADHD, and autism. There is almost a clamor for diagnosis. Now, my question really is, from all the models that we discussed, was there any self-help models that we can prescribe? And my second question is, where does your unique personality end? And why this new clamor for these labels that are, I mean, it is now beginning to take a significant chunk of work, and people are very happy to say. And I ask them, why do you, okay, it won't make a difference to your job, your career, your life, whatever. Why would you want to be called as autistic or ADHD? As they said, doctor, it will help me understand myself better. Any thoughts on that is appreciated.
Yeah, that is a very good question. Like people like to find the crutches of a diagnosis, So that trend is happening. Like people want to be labeled something to justify their behaviors, to justify their shortcomings. But ultimately, one has to realize that human beings have immense and enormous potential. So